Hi guys, my name is Karen Dees. I am the marketing manager for Patient Concierge Services. For those of you that don't know who we are, we provide a booking agent service facilitating appointments with doctors and surgeons throughout Bali, and we also provide a concierge care plan, wraparound service from picking you up at the airport, chaperoning you throughout all of your appointments, as well as the aftercare with caregivers and nurses. And part of our exciting service is getting to know the doctors. And today we have Dr. Hendra.
Yay!
Yes, from Bali Aesthetic Center, as you can see from the branding behind. So we'd just really love to learn a little bit more about you.
Okay.
How long have you been a doctor?
Yeah, I've been a doctor, For the plastic surgeon,
yes,
I mostly 2 years for now.
Two or three?
Three. Yeah, 3 years. But in the GP, before maybe in 2014.
Whoa! So you've been a GP for 11 years?
Yeah.
And then a plastic surgeon for 3 years?
3 years. I practice, but I trained the plastic surgeon for 5 years.
Oh my goodness. So let me get this right in my head. So 11 years as a GP, part of those 5 years training as a plastic surgeon, and then a fully fledged plastic surgeon for the last 3 years. Yeah. Wow, you must really know the body well.
Yeah.
What inspired you to become a plastic surgeon after being a GP?
I really love arts. Since I was young, especially like drawing.
Yes.
Yeah, I love drawing people or something like that. And I find in plastic surgery, the combination of art and science will make or produce the harmonious result.
Harmonious result.
And natural. Like
natural.
Yeah.
Wow. And just so that our viewers, because we have a Facebook group called STAR, stands for Surgical Transformation and Aesthetic Rejuvenation, and we're also friends with another Facebook group called FLIB, which is Facelift in Bali, and the founder is called Pamela Lovegrove, so we'll put this video in both groups. So for everybody that's watching, what is your menu of options? It's what can you do?
Since I was a plastic surgeon, I do a lot of things, like wide range of cosmetic procedures and the reconstructive one too.
And reconstructive.
Yeah. But for maybe 2 years behind, we focus with facial rejuvenation.
Facial rejuvenation. What does that mean?
Make people or face of the patients look more fresh. Young, and we must keep the natural.
I love that. Yes. Shouldn't that always be the goal?
Yes.
Is to be fresh and natural? But we do see some celebrities that go too far, But you always make sure that the patient is maybe just a fresher version of themselves.
Yeah, of course. But at the first, before we do the surgery and the patient decide the procedure, we must have a chat and consultation first, and I must understand what patient needs and what patient expectation, and so I can help them, to make it a real, a real natural, harmonious, and something like that.
Okay, so let's go through the list. Facelift?
Yeah, the facelift. Elite surgery.
So upper and lower blepharoplastering?
Yeah, of course. And both too.
And both,
And we can do the lip lift.
The lip lift, that's the one where you go under the nose?
Yeah,
okay.
Lip lift. And after that, we can do a fat transfer to the face.
Okay. Would you ever do fat transfer whilst you're doing the facelift?
It can be. If the patient needs that, we can combine the procedures.
Because I've noticed, because we study lots of different doctors, and there's one doctor, obviously in America, not in Bali, but he always does the fat transfer with the facelift, especially if they've lost volume under their eyes. Yeah,
because the aging is not only just sagging skin.
Yes.
It can be volume loss too.
Okay.
Yeah. So after we do the facelift, maybe some volume still lost. So we must fill the fat to make it more youthful look.
Make it more youthful look. Okay, let's just stay on the facelift topic a little bit longer, because I'd say it's the most popular procedure. Is it always an automatic combination to include the neck? Or would you ever do a facelift without the neck?
Yeah, at first we must examine the patient first.
Examine the patient first.
If I think the face more sagging and the neck is still good, I think I recommend just only facelift, not neck lift.
So that would probably be someone maybe a bit younger. Maybe a bit younger, like in their 40s. And they don't necessarily need it. But would you say the majority of the time they need to have the neck as well?
Of course.
Yes. Okay, amazing. Okay, a little bit more on the facelift. I don't know the correct medical term for the name, so forgive me. Well, it looks like a webbing effect. It's like additional stitching, which I believe, what I've learned from another doctor, enhances the long-term effects. It also means the patient doesn't need to wear a garment, I think, and it reduces the swelling. What is that called?
Actually, if in the people, our patients, it will call webbing, but in the medical term, it's like a hemostatic net.
Hemostatic net. Okay, and why? Okay, so I think that's the reason why. Am I right or wrong in thinking that it prolongs the effects, reduces swelling, and no garment?
The first one, I think, is not too much effect, like a longer result. It's not. But for the reduce swollen and stop bleeding or hematome.
So it's more for safety.
Because it will be a replacement of the use of garment. Because we use garment for like
to keep it tight.
To keep it tight and make reduce the swollen like that. So we add the net or webbing for make the skin
tight. Amazing. Okay.
But maybe some people, I think, like scared about having much net or webbing in the face. So maybe some people prefer use garment. Maybe some people use webbing.
So you give it as an option. Because when I first seen it on a patient, I'll be honest, it looked quite barbaric. I was like, it looks really scary. But then when I heard about the benefits, I was like, and they take the stitches out. I think 3 days post.
2 or 3 days.
So you're not left with any holes.
No.
Okay, so there's no scarring.
No scarring.
There's no scarring. So when you do your facelift, do you go usually around here, around the ear, and then back of the ear into the hairline?
Of course.
Always? And do you always do a deep plane facelift?
We can do options for patients. There's we can do the SMAS application,
SMAS,
SMAS application.
Which means it's not as deep?
Not as deep, but we just modify the SMAS. That sagging SMAS, we make it tight by application.
What's that?
Make a stitching. Make a ripple stitching. Like tight. But we don't remove any SMAS. So the risk is smaller than the deep plane.
So the risk is smaller because you're not working with the muscles and the nerve endings. Is that correct?
The muscle you still use the muscle, but I think not too deep as nerves. So the nerves will be not like cut or something like that. So I guess if somebody would it be right in saying a mini facelift would be similar to a SMAS? No. I think mini facelift is like just area.
Okay, so that would just be like maybe a lower.
That's like this one. Not until jaw or something like that.
Okay, I understand.
But not not too much change for a patient.
Okay, last question on the facelift one. Do you do any endoscopic surgery?
I think not yet.
No, it's not as popular in Bali. I think.
In Bali.
And so if somebody wanted a brow lift, you can still do this.
You can
still like with small incisions.
Small incision.
Okay, fantastic. Let's wrap up on the facelift and move on to the next one. So, Dr. Hendra, I know that you do facelifts, but I'd like to talk about the body today. Okay. So tell me what part of the body you can do surgery on.
We can do a lot of surgery in the body, but mostly the popular one is like body contouring.
Body contouring.
Liposuction to the arms, maybe for the stomach, abdomen, and the thigh too.
So that's like a fat liposuction and then transfer to another location?
No, just
liposuction.
Okay,
can you do fat transfer?
I can do fat transfer.
Like a BBL, Brazilian bum lift?
Bum lift, I think it's not popular here.
So where would you transfer the fat to?
Mostly in the face.
Mostly in the
Yeah.
face. Okay. So not a relocation on the body as much. Okay.
Yeah.
And what about breast augmentation?
Breast augmentation, we can do that in here. We use silicone implant.
Use silicone implant? Okay. So if somebody already had implants and they wanted to maybe have like a replacement and an uplift, you can do this?
You can.
Yeah. Do you have any techniques that
for
breast augmentation, like the scarring and things?
I prefer do breast augmentation with the incision in the inflammatory.
Okay.
Yeah, because it will make sure the placement of the implant it's right. Yeah.
Okay.
Because if we use like in the axilla or in the umbilicus, it can be like hidden scar. But for the placement of the implants, it will be like difficult and not like in proper place. Maybe.
Can I just check I've heard you correctly? You said through the umbilical.
Yeah, umbilicus.
You can put a breast implant through the umbilical. What? I did not know this.
You don't know?
No.
Yeah, it can be.
No way.
From there.
You can go through the belly button with an implant?
Maybe just like
a smaller size?
Yeah, small incision.
I did not know that was even an option, but it's like not as common, right?
Not as common, but I think for the surgeon as like skillful surgeon, the incision like that, it can be used successful. But I think if not, I think
it's better to go underneath. Like you say, you can place it more accurately. And then you can go under the muscle or just on top, that kind of thing.
Yeah.
Right, okay. And okay, let's move on to the other part. What about the stomach? Can you do tummy tuck?
Yeah, of course.
You can?
Yeah.
Fantastic. Okay, let's learn a little bit more about the clinic, because you don't have overnight stay.
Yeah.
That's correct, yeah?
Yeah.
So it's always day surgery.
Yeah.
Okay, for anybody who might be a little bit worried about having major surgery in day surgery, is there anything that you could say that would reassure them?
In this clinic, we do mostly surgery with 1 day. After that, you can go home. Because we do every surgery with light sedation and a combination with the local anesthesia too.
Okay.
Yeah.
So you use local anesthetic. It's still general anesthetic though, right?
Like light sedation, not
Twilight.
Yeah, twilight.
Is the patient responsible for their own breathing, or do you use a machine?
The patient, of course, with their own breathing.
Okay.
Yeah. And I think we can control like duration of the surgery.
Okay.
And then after the procedure, there's same hemodynamic of the patient.
Okay.
Yeah, because if we go for like general anesthesia, like intubation or something, it's the machine will control us.
Yes.
And after we wake up, maybe it can make our vessels or vascular, can be like bleeding or something like that.
Okay. So you do lighter sedation with local anesthetic, which means it's less recovery. Would you say?
Faster recovery.
Okay. So how many hours would somebody be put under this sedation for say like a facelift?
Initially for the twilight sedation, it can be like 2 or 3 hours.
Okay.
But for facelift, it can be longer. We use in this clinic monitor anesthetic care.
Monitor anesthetic care. Okay, I'm learning something new today.
Yeah. We use like a thing. It's like syringe pump. Syringe pump. Yeah, we place the medication or like sedation medication there, and the medication will be
like administered through this. Okay.
Like that continuously. With the small parts.
Okay.
So you will have a relax and good for surgery.
So I saw a facelift that you did with an Australian gentleman, and it was so good. He was like 59, and his results are amazing. Thank you so much for telling us all about the facelift procedure. Another question that we get asked quite a lot is how many procedures on the face have you done?
Okay, for the facelift, I think for in hospital and this clinic, I think it's over 50.
Over 50. Amazing. So, Dr. Hendra, if somebody arrives and they're about to have surgery, what would their journey be walking through the clinic? Could you perhaps show us?
Okay, I'd love to show you.
Excellent.
Okay. Come. This is a pre-operation room. After the patient enough for the consultation and decide for the surgery, we go to this room. It's this pre-operating room. Yeah, we go for prepare the patient to get ready for the surgery. This is the room. Yeah, this is the bedroom for a patient. We do with magic drawing, magic pen, to have preparation and encourage the patient, to get ready. After the patient is ready, we can do the next room.
Okay.
Yeah. This is the surgery room.
Wow, it smells so clean. I love the smell of bleach.
Yeah, we do our surgery in here.
Okay, so at this point, would the patient be asleep?
Yeah.
Okay, so they would go to sleep in the preparation?
No. We just instruction the patient for sleep here, and after that we put the intravenous line.
Yes.
And after that we just go for the medication of sedation.
Okay.
Yeah.
So in the pre-medical room, you're just the sketching, and then they would walk in here, lay on the bed, and then you would administer the sleeping. Yeah. Okay, great. Amazing. Is there anything else in this room? But I mean, what would be the sterilization and cleaning standards for a theatre room? I guess it has to be quite strict.
Yeah. Well, after we do this surgery, we just clean all by like chlorine and alcohol and something like that.
Okay.
And after that, we have UV light for sterilization.
You use UV light?
Yeah.
Oh my god, I love this. I've never heard of that before.
Yeah.
So that removes any form of germs and blood, bacteria.
Yeah.
That's a really, really, really good piece of information.
Yeah.
I love that.
Okay.
Yes.
And the next room is with here. We for recovery room.
Yes.
This recovery room for the patient while waiting for all the medication is relieved and something. Slowly wake up and ready to go home.
Amazing. Okay, so they would just rest in here for maybe a few hours after surgery.
Just 1 till 2 hours.
Just like a couple of hours, monitoring their blood pressure, oxygen,
pulse rate, oxygen.
How they are responding. Okay. And then when they go home, do we have nursing available? I mean, obviously we have nurses part of our service, but I believe you do too.
Yeah, we have like home visit.
Home visits.
Yeah, maybe like 1 day after the surgery.
Okay.
Yeah, we do the home visit and for clean the wound and something like that, and maybe we can do like 3 times maybe before the patient come back for the remove stitches.
So they would only have 1 follow-up appointment back here to get the stitches out.
Yeah.
Approximately 8 days or
for facelift maybe like 12 to 14 days.
12 to 14 days.
Yeah, but like eyelid surgery maybe like 5 till 7 days.
Because the skin is more delicate?
Yeah.
Okay. And if somebody really needed to get home back to Australia, could they get the stitches out at home with their own GP?
Could be.
You could provide a letter for them?
Yeah, I will write the referral.
Yeah. And if they, for whatever reason, needed a fit to fly letter, for when they're getting their flight back, you can provide this too?
Yeah, we can do.
Because they might look different, yeah? I promise it's me on this passport.
But in this clinic, we always natural result.
Natural result?
Yeah, so maybe you just look younger, not like someone else.
Yeah, but they may have bruising and swelling.
Yeah, of course. Yeah.
Thank you so much. Is there any other rooms you'd like to show us?
Yeah.
Okay, great. Thank you for showing us the ground floor.
So we can go upstairs for the consultation room.
Excellent.
Okay. Yes, this is our consultation room.
Beautiful.
Yeah.
So bright.
Yeah.
Great. So somebody would come in here just before they go into surgery and just double check all the paperwork, check that they've, I guess, made their payment. And anything else that you check, or is that a temperature?
Yeah, temperature,
Yeah.
And we have blood pressure test too.
So you do like the tests again. Oh, that was another question actually. Do they have to have pre-medical checks?
Of course.
Okay, and that would be here, or would you send them to a clinic?
We send to the laboratory. Yeah.
Which laboratory is it?
It can be in Prodia. You know Prodia?
Yeah. Okay, I know Prodia. So if they wanted to get them done in Australia before they come, they can?
It can be.
How many weeks
maybe
before?
Like 1 week.
1 week before.
Maximum 1 week.
Maximum 1 week before. So we could give them a list of things to check.
Of course.
And then just in case anything flagged up. But usually people will come and get it from Bali.
And we can call the staff with Prodia to come here to check you in here too.
Oh, that would be good. If somebody's a little bit nervous if it's their first time in Bali. Okay, great. So you'll already have the pre-medical checks, and then this would be the next stage. You'd go through the results, tell them everything is clear, blood pressure, temperature, and then anything else happening here?
Yeah, just that.
Just that. Great.
This is our sterilization room. It's a small room. After we use the equipment for surgery, we sterilize in this machine. This machine. And after that, we pack it all over, and keep it in the good place.
Dr. Hendra, that was amazing. Thank you so much for your time.
Thank you for having me.
So we're wrapping up now. Any last messages?
At the end of the day, I just love what I do.
Okay.
Combining with art and surgery to help people to make confidence. And of course, it's natural.
Natural confidence, empowerment. Excellent. Thank you. Anybody want to book in with Dr. Hendra, please WhatsApp PCS and we'll facilitate the appointment for you. Thanks for watching.